It's now my great pleasure to welcome our first speaker for the day, Minister Rose Jackson. The Minister is the Minister for, ready? Water, housing, homelessness, mental health, youth and the North Coast. Your presence today, Minister, is highly valued as we explore how to rectify the silos between our sectors and the impact this is having statewide on our workforce and the people accessing services. On behalf of MHCC and NADA, please join me in welcoming the Minister.
Thank you so much, Evelini. It's lovely to be here. I'd like to start by acknowledging the traditional owners of the land and pay my respects to elders past, present, and extend that respect and acknowledgement to any Aboriginal people joining us for today's conversation. I'd like to thank the NHCC and NADA for the opportunity to come and say a few brief words at the beginning of today's important event. And I'd also like to acknowledge people in the room with lived experience of both mental illness and drug and alcohol issues. And I do that particularly because my experience as a politician is one of the purposes of the conversation today is to make change, to improve the way that services are delivered, to improve the way that collaboration happens. And when I think about what it takes to make change, having the facts and the statistics and the evidence base clearly helps and is important, and I encourage us to have those things and to have those tools and to use them and to talk about them. But unfortunately, in a way, it's not enough just to have that, and I think we know it's not enough because in a way we've had the facts and the evidence base and the statistics for quite some time. And things haven't changed. And one of the things that I see as a politician as a key ingredient in actually persuading decision makers to do things differently and better is personal stories, is connection, is narrative, is people talking about what are otherwise quite theoretical concepts as lived experience. And so the role and the presence of people with lived experience in these conversations obviously make service delivery better. We all know that. Everyone in this room would be committed to principles of co-design and understand how that collaboration makes service delivery better. But from my point of view, not as a clinician, but as a politician, as a decision maker, actually those stories are incredibly important and powerful for us as well. So thank you so much to people with lived experience for having that courage and bravery to share your experiences. As I said, it's incredibly important to make sure other people get service delivery in a quality way, but it's also incredibly important in getting politicians to pull their socks up and actually do the things that you have been saying and has been evidence-based for some time. I don't want to speak too long. I really just want to say three things. The first thing is we know that the relationship between people with mental illness and drug and alcohol issues is significant. We recognise that those things sit together. We recognise that issues of self-medication, of condition exacerbation are all very profound and very pronounced. There's no question from the New South Wales government's point of view that these issues cannot be addressed in a siloed way. So we start off, I think, in a good place, a recognition of the deep interlinking and intermingling of mental illness and alcohol and other drugs. So that's a good step. The second point I want to make is we recognise that the solution to that problem is integration, is service collaboration. It's more than just connection, and I think it's great that you've called this conversation collaborative connections. It's not just about knowing that these issues are linked and that other services exist. It's about actually trying to collaborate with them. Again, that's not new. This idea, as has been mentioned, that the response to the problem that we recognise and acknowledge is real is collaboration and connection. That's also not new information. We've known for a long time that the only way to actually respond to that challenge of the relationship between people experiencing mental illness and people with alcohol and other drug issues is by working together. The challenge is, well, if we've known that this is a problem and we've known in a way what the solution is, sure, of course there's been clinical developments over the last 15 years, and in a way these kind of gatherings will never cease to be useful. There will always be a value in coming together, in sharing expertise, in updating our knowledge, in comparing clinical examples. So, of course, that has evolved, but the fundamental premise of so we need to work together. We need to do transdiagnostic. We need to do combined treatment. We don't want people telling their story again and again. We want our services designed around the person, as opposed to them having to go through 5 different front doors and tell their story 5 different times. That concept is well known. I think the struggle, and of course for government and more profoundly for everyone in this room, is, well, why is it then hard for us to deliver on that commitment to person-centred care, if that's what we know works? And I think, my reflection is it's challenging because, one, government is profoundly siloed. It's been one of the most eye-opening experiences for me in my first year in government, just how siloed we are. And we are not well set up to deliver on that commitment to try and respond in a collaborative way. So I think that is challenging. I think ways to overcome that are top of my agenda, but I really welcome the opportunity for further feedback today, is things like co-location, physical co-location. The examples where I've seen of that happening, I think is a practical example of what we can do to not just talk about collaboration, to actually deliver it. Of course, service teams that work together, clinical teams that work together, and that actually being embedded in the model of care is incredibly important. I think state services being more respectful and open to community-based services is another example where we can really make sure that, again, we're not just talking about these being good ideas, we're actually doing them. And I think it is a little bit on state services to be much more respectful and responsive to community-based services as we actually look to deliver that support to the person together. The other one that I'll mention is state and Commonwealth services. Of course, another example of a deep silo that we exist. There's been a couple of green shoots in terms of PHNs and LHDs actually being able to work together. But even that is quite preliminary, let alone trying to bring the community health ecosystem into that. So I think that is another area where we have to have a good opportunity to focus. And of course, another one, this is not the last one that I'll mention, but I welcome the outcomes from today in terms of the practical things we can do, is it not just being mental health and alcohol and other drugs, but housing, other psychosocial contributors. There are so many other parts of the currently fragmented and siloed world in which a consumer is trying to navigate the service support system to get the help that they need, where we say to them, no, well, sorry, that's not me, that's there. Call this phone number, go on this website. I mean, everyone in this room, these are vulnerable people, and we make our system so difficult and impenetrable. So yes, alcohol and other drugs, of course, these collaborative connections are valuable, but I'm very committed as also the Minister for Housing. Let's get housing in the conversation. Let's get homeless health in the conversation. And I know that NADA and the NHCC are very committed to that, but as the Minister, I want to say, I want to be part of ensuring that this connection is strengthened by bringing all of the other connections in to really bolster it. So it's not a flimsy connection, it's not a weak connection, it's a very strong connection. So those are some reflections on me on, yes, the problem, as I said, the well-recognised solution, how we might actually get practical about it. But the last thing I'll say is I am of the view that there is a genuine opportunity and moment now to actually lean into this. And as I said, 15 years for these fabulous organisations having these same conversations, a clear body of evidence that this is the work that we need to do, the banging of the head against the wall, why can't we get this stuff embedded? My message to you is I think there is a genuine opportunity right now. We did have the special inquiry into ICE. Of course, I'm of the view that the previous government's response to that was relatively underwhelming, but even they did acknowledge the value of some of those recommendations. That body of work is still sitting there, is still fresh, and is a start. The Drug Summit is a great opportunity. I know that we need to have it, we need to set a date for it, we need to be clear about it, give you a commitment that that will happen. Obviously, as Rob mentioned, strong advocate for that in government. It will happen, and it will be good. It will be good. I'm very confident that that is, again, another genuine moment. Of course, I recognise many people in this room are going to say, we don't need another summit. You know, we know this work. But again, as a politician, when I have conversations like this with my colleagues in Parliament, there is still work to do to bring people on the journey of the work that you do every single day. And I'm confident that the Drug Summit provides that great opportunity. There's also an incredible goodwill across the Cabinet to make this stuff work better. Some of the sort of ministerial territorialism, siloed thinking at the Cabinet level, sharp elbows that might exist between political decision makers after 12 years in government. I think that's a comment that applies to all sides of politics. Isn't there with the new government. We genuinely are enthusiastic about taking our new portfolios and finding ways to work together and do good things. And so for all of those reasons, I do want to say I feel as though there is a moment now where people are interested in taking the steps that we need to take to actually make this work better. And of course, it's going to be an iterative process. Of course, over the next few years, I hope when these gatherings happen, a step forward will have been taken. We'll still be saying there's more to do, but that there will be acknowledgement of, well, we did that thing and that was good. And now let's do the next thing. And now let's do the next thing. And that there is a build-up of progress over the next few years, taking the opportunity of momentum that we have now. So good luck for today's conversations. I hope that it will really feed in to the opportunities that we have, whether it's through the Drug Summit or the response to the ICE inquiry, or the enthusiasm for ministers to work together to make this moment that we have a really fruitful and productive one to do the work that we know that we need to do. Thank you.